So I'm sorry, I apologize. I don't have the talk on the screen here, so I'll have to look there and see what's on the screen before I can actually talk to you. So it's a little awkward, but let's do it. So the first part is to review the normal anatomy, so what is normal inside the eye and inside the brain. And then we'll look at the signs inside the eyes that can tell us that there's something neural going on in a specific patient. Then we'll talk about the signs outside the eyes that I can see or other people can see. Oh, thank you. Yeah, perfect. Thank you. And then we'll talk about different diseases that can affect the vision, like neural problems that can affect the vision. So let's talk about the normal. So you have the eyeball. Can you all hear me? Yeah, okay. So you have the normal eyeball. So the front part of the eye is what we call like the cornea. That's the window in front of the eye. You have the pupil, which is actually a hole inside the eye, so the light can go inside. Then you have the lens. So when you have a cataract, that's this part of the eye that is affected right here. So the light goes through that and will hit the retina and the optic nerve in the back. So if you look here in the back, it looks like this here. So the little sun that you see there, the little circle, is actually the optic nerve, and you have all the blood vessels on the retina. So it's basically the retina that goes inside the optic nerve, and the optic nerve travels to the brain in the back. So when I look inside the eye, I can look at the optic nerve and see if I see any changes there. So that's what I see when I look inside the eye. So I see the head of the optic nerve. So it's only one little part of the optic nerve. The optic nerve is actually quite long. It travels, so that's a imaging. So we're looking like we're cutting the brain this way. So now we're looking from above. So we see the eyeball right here with the muscles. The optic nerve is actually right here. You see how long it is? So it starts in the back of the eye, so that's what I see when I look. Just this part right here goes all the way back, and it will reach the brain. So before it goes to the brain, it does something very interesting. So I'll show you on the other slide here. So when it goes further back, it goes right above the pituitary gland, and then both nerves will merge together. It's like an X. So they will come together before going to the brain. And where they cross, it's called the chiasm. The chiasm is right above the pituitary gland. So why is it important? But if you have a pituitary gland tumor, then it can push on your nerve and you can lose vision. So far you're following? Okay. So another view here from above. So you have the eyeballs, the optic nerve, they merge together, right? They cross, that's the chiasm. And then it goes further back in the brain. That's what we call the optic tract. Then eventually you'll have the optic radiations that will go all the way to the occipital lobe of your brain. So anything that can affect that pathway will give you some vision loss. It doesn't matter where it is. The pattern of the vision loss will be different if it's here or there, but you'll still lose vision because the pathway is affected. So what can I see inside the eye that is not normal? So this is, the first picture is the normal optic nerve. So when we look at it, it should be orange in color. And there's a little hole in the inside right here that we call the cup. The cup usually is less than half the size of the optic nerve in normal patients. If the cup is bigger than half, it's suspicious for glaucoma. So if your doctor tells you you are a glaucoma suspect, it means that the cup is a little bigger than usual. So we look at the cup, we look at the color of the nerve, and we look at the contour of the nerve and see if there's any swelling of the nerve. So right here, you have optic nerve pallor. If you look at the color, it's not orange, it's white. So it means that that nerve got injured. It's not glaucoma, it's not that the cup is big, it's that the nerve lost its fiber, all its fibers. So what can give you optic nerve atrophy? Well, a lot of different things. Anything that will injure your optic nerve will give you that. So if you have a stroke of the optic nerve, inflammation of the nerve. Trauma, right? If you hit your head and you get a fracture and the bone hits the optic nerve, you will lose vision in that eye and your nerve will end up like this. So it doesn't really tell me what the problem is, but it tells me that something happened to the optic nerve. And if you have something even a little deeper where the chiasm is, you can end up with optic nerve atrophy like this here. Because eventually your nerve will die, and that's what I will see when I look inside the eye. So we talked about the pituitary gland. So that's an MRI, and here we're slicing the brain this way right here, right in the center. Boom, right there. So if you look right here, so that's the nose. And here you have your pituitary gland right there. And the optic chiasm is right here, right? That's where the nerves cross. So here it's a normal patient. You see there's a gap between the pituitary gland and the chiasm. So this patient here is not at risk of losing vision. But look at this patient here. This patient has a pituitary gland tumor, right? It's a big mass. The mass is so big that it's actually pushing the chiasm up right here. So if we don't do anything, that chiasm eventually will suffer, and then we'll start seeing some signs inside the eyes. So the patient will also complain of vision loss. So we have to do something when we see that. I'll show you some pictures in a few minutes. Any questions about optic nerve pallor? Well, that's what we call atrophy. Yes?
So if you see that optic nerve pallor where there's no orange there on the right, so it can be anywhere along the line from the optic chiasm all the way.
Right.
You don't really know how deep the damage is.
I have no idea where the damage is, but I know it's in front of the chiasm, or more like anterior. Thank you. So if it's posterior to the chiasm, usually you don't get atrophy of the optic nerve. I'll show you some pictures of that too. So another thing that can happen to the optic nerve is some swelling. Swelling, again, is not something, it's not a diagnosis. So it's not, I don't know why the nerve is swollen. I have to figure out why it's swollen. Swelling means that there's something going on with the nerve. It could be that the nerve just had a stroke and the nerve is responding by, if the nerve is dying, and when the nerve dies, it starts swelling. It could be some inflammation of the nerve. Something active is going on. Long term, you'll see atrophy, but when it just started, that's what we see. We see some swelling. Another thing that can give optic nerve swelling is if the pressure inside your head is too high. Most patients will have swelling of both optic nerves. Those patients don't necessarily complain of vision loss, but they'll complain that when they bend down, they gray out or black out, and then the vision comes back when they go back up. So the presentation will help me know why the nerve is swollen. So if it's a patient that is 75 years old with a lot of cardiovascular risk factors, and patient comes with vision loss in one eye and some swelling, then it could be a stroke of the optic nerve. If the patient comes with optic nerve swelling of both eyes, young patient, and complains of blackouts when bending down, but no vision loss otherwise, then I start thinking of increased pressure inside the eye. So it really depends if there's some vision loss associated with the swelling or not. And then my workup will be different, right? If I feel that it's more something that is local to the optic nerve, or because the pressure is too high inside the brain. So how can we tell, let's say I think that the pressure is too high inside the brain. I just saw a patient today, a young girl, 18-year-old, had a VP shunt, like a shunt to take the fluid from the brain and bring it to the abdomen to decrease the pressure. So she had that when she was younger, started complaining of headaches and blacking out when she was bending down. So the neurosurgeon wanted to know if the nerves were swollen. Both nerves were swollen, so I called the neurosurgeon and I said, I think the pressure is too high inside her head. So the neurosurgeon said, okay, I'll go back and I will repeat the VP shunt. I'll put a new one inside her head. So in adults, so what are the signs of that? So patients will complain of graying out of the vision and the nerves will be swollen. So in kids, it's very easy to know if the pressure is too high inside the head because the fontanelle is still open, right? The bones are not fused yet. So you just touch, and if it's bulging, it means that the pressure is too high. So it looks like this here. So you'll see a little bump right here. So this kid here probably doesn't have optic nerve swelling because the pressure goes here instead of going to the optic nerve. And if we don't do anything, eventually the head will start growing, right? So in adults, it doesn't do that because the bones are fused. So I cannot look at the fontanelle. I look inside the eyes. And then I will see the nerves are swollen. So then I'll do an MRI to try to figure out why the pressure is too high. Sometimes, not always, but sometimes we'll see that. So that's a normal patient here. And here, that's a patient with increased intracranial pressure. That's what the ICP stands for. So you'll see that the nerves are very big, and they look kind of swollen, right? If you compare these two pictures right here. So if I see that, I'll be like, oh, yeah, it's really swollen here. But it doesn't tell me why it's swollen. So yeah, so normal nerve, swollen nerve. So now the next step is to know why it is swollen. So we'll look at the brain, and we'll see if there's a mass. If you have a mass inside your brain, the brain is surrounded by bones. So if you have a lesion, it takes some space, and the fluid cannot really circulate inside the brain, so the pressure will go up. So the first thing that we have to rule out is a brain tumor. So here, that's a patient with a pretty big benign brain tumor, and this one is actually a cancer. So you see that a cancer looks very different from a benign tumor. And these two here, these two patients can definitely have increased intracranial pressure from the tumor. If you have a meningitis, that's what we see here. So here we're cutting the brain this way here. We're like right there. So we see all the meninges around the brain, and here you see how it's white. White, it means that it's inflamed. So it could be inflammation or infection. So we can do a spinal tap, like just put a little needle in the back to take some fluid, and we can analyze and see if there are some bugs there. So when we do the spinal, let's say that we do the MRI, and the MRI comes back perfectly normal. Then we don't have an explanation for the optic nerve swelling. So what we can do is when we do the spinal tap, we measure the opening pressure. So we measure the pressure of the fluid. If the pressure is too high, then we know that that's the cause of the optic nerve swelling. So young females, mostly obese females, can get increased pressure in the brain for no reason. We think it's just the circulation is not as good because of the fat inside the brain. So, but we always want to rule out a tumor. So we always do an MRI, make sure there's no tumor. Then we do a spinal tap, make sure there's no infection, and we measure the opening pressure. And if the pressure is high, we prescribe medicine to decrease the pressure of the brain. And then the nerves get better over time. Any questions? It's not an easy topic. Yeah.
So actually, if somebody is obese, they will have increased fat in the brain?
Yeah, we feel that the fluid, the production of fluid is the same, but the evacuation is not as good because of the fat deposition in the brain.
Do you find that in obese men too?
No, no. I mean, we can see that in young kids or in males, but usually kids and males are not obese, and we don't know why they have that condition. But typically, it's in young female and overweight, obese females. Yes?
You talk about the stroke, and I know there is kind of borderline that my eye is affected, either in glaucoma or a stroke. Is there something can be done?
To treat it, you mean? Or to know if it's a glaucoma or if it's a stroke?
Well, I would rather have a treatment done to
Right.
better.
So, yeah. Right. So the thing is, I'll be right with you. So the thing is, it depends what the cause is. You have to figure out, is it glaucoma or is it a stroke? A stroke, we don't have treatments because the optic nerve is actually part of the brain. So if you have a stroke of the brain, there's nothing really we can do, right, to regenerate those nerves. It's the same thing with the optic nerve. So if it's a stroke, we don't have any treatment as of now. There's a lot of research going on right now, so maybe in a couple of years we'll have some treatments, but not now. Glaucoma, we do have treatments. So that's why it's important to know what it is, because then you can start eye drops or have surgery to help with the glaucoma.
Okay.
Yes.
So I have gone through that one. Okay.
I'm sorry, you can.
The questions when they're asked.
Oh, sure, yes. Yes, she asked me between glaucoma and stroke, what was the, how can we figure out what it is and if there's a treatment for it? Yeah, sorry about that. Yes.
You mentioned swollen when you bend down. So, I mean, I know sometimes you bend down, you get a floater too. So, do you try to avoid bending down?
No, it's not dangerous. You won't damage anything. It's just a sign that the nerves are swollen. So if every time you change position, then you black out, it's just a sign that it's swollen. It's nothing that will damage anything. So I will not recommend stopping that by doing that. It's not dangerous. It's a question and I ask. And other questions I ask is about the whooshing sound. So often when the pressure is too high, patients will hear like a in one or both ears. That can also be a sign of increased pressure. And double vision can also be a sign of increased pressure. So we have like little signs, like little questions we can ask to kind of pinpoint what the problem is. Yes?
These optic nerve strokes, which intracranial vessels most commonly would cause them?
So it's not intracranial, it's really a blood vessel inside the optic nerve head. In the optic nerve head, we have tiny, tiny, tiny blood vessels, and it's a watershed area. So it doesn't take much actually to get a stroke in that area. And usually it happens at night, because we think that it's when the blood pressure goes down, that watershed area doesn't get the blood flow that was needed. So we see that mostly in older patients because the blood vessels are a little, the walls are a little thicker, so the blood flow is a little harder to reach those little areas there. Yep.
What's happening if you see stars, if you bend over and stand up or something?
Okay, so if you see stars, it means that your blood pressure is probably a little low. So if you have low blood pressure, you'll see stars, you can see a little dark, and you'll be a little dizzy, right? It will last just a few seconds, and then it will go back to normal when your blood pressure goes back to normal. So those patients will have increased intracranial pressure when they bend down and they black out. They don't have those stars or dizziness. Just like a total blackout without any other symptoms. Sorry, I think he was first. I'll be right with you.
You mentioned double vision. Is that one eye sees one thing and the other eye sees a different image, either because it's translated this way
So,
or also rotated?
right, so we'll talk about double vision in a few minutes, but yeah, so you have two types of double vision. You have the one where it's monocular. It means that you cover one eye and it's still double. So if that happens, it means that there's something inside your eyeball that is preventing the light from going straight inside your eye. So if you have dry eyes or cataract, you can get that. So the double vision that is neuro-related is when both eyes are open. The eyes are just not working together. You cover one eye, the double vision goes away. You cover the other eye, the double vision goes away. But both eyes together, it's not working. So it means that you look at something, like I'm looking at the restroom sign right there, I will see one like right next to it or like above it, right? So that's what double vision is. And it can be torsional, so depending on which nerve is affected, we'll come back, you can see torsion as well. Yes?
What's the actual difference between inflammation and swelling, as you say?
So difference between inflammation and swelling. So swelling is not a diagnosis. It doesn't tell me what the problem is. It's just a sign that I see inside the eye, and I have to figure out what the cause is. Inflammation is one of those causes that can give you optic nerve swelling. So besides inflammation, you can have a stroke, you can have a tumor that is pushing on your nerve, you can have increased pressure inside the head. So if I see swelling, it doesn't tell me what the reason is. So I have to figure it out, basically. That's my role. Any other questions?